Why do doctors recommend against a Y strap manipulation? You can have a vertebral artery dissection, which causes a stroke, and then you're paralyzed. It's not working.
All right. Well, this is a common misconception. This gentleman is a medical doctor and has probably limited experience with the spine in general. I can tell you the YA strap adjustment has been going on for a very long time. There is not one clinical study that's been done to actually show that this particular technique does dissect the vertebral artery. And in fact, I will argue with any medical doctor on the planet to show me any peer-reviewed studies that show that chiropractic care and manipulating the neck appropriately and correctly causes any stroke. I've looked at many research articles. I've looked at so much research out there, and I have not seen a great study that is peer-reviewed that actually shows that there's a connection between spinal manipulation of the neck done correctly by a professional who knows what they're doing and a stroke. Yes, it is possible. Yes, anything is possible. In fact, most of the research shows out there that if you saw a medical doctor for the same reason that you have neck pain and saw a chiropractor for, the relationship of stroke is equal for the medical doctor and the chiropractor. And it has nothing to do with the actual treatment. It has to do with the pathology that's involved. Many times we can get clots in the vertebral arteries for a variety of reasons, or you have congenital malformation of those arteries in the vertebral bones, causing that to be a possibility. But let me assure you, if my malpractice insurance company knew that this was a possibility, I would pay hundreds of thousands of dollars in malpractice insurance every single year. My malpractice insurance is a primary spine care, physical therapy, chiropractic, and some medical treatment is only about $2,800 per month. If you're a spine surgeon, you're going to be spending tens of thousands of dollars, if not $100,000 a month on malpractice insurance, where mine's $2,800 per year. Ask your medical doctor what their malpractice insurance is per year. Remember, those insurance policies are based on risk. What is the risk that this patient would be injured or killed, permanently disabled or killed with any treatment that we provide? And I can tell you statistically, chiropractic care is extraordinarily safe. And in fact, our efficacy and our safety is equivalent to actually being better than aspirin or Tylenol. Aspirin or Tylenol injures more people per year than a chiropractic adjustment. Aspirin and Tylenol kill more people than chiropractors do per year. Yes, there's risk. There's always going to be risk no matter what you do. But in terms of efficacy and safety, chiropractic done by a licensed chiropractor correctly at the right time has amazing results and is very low risk. Is there risk? There's risk in everything, yes. But it's one of the safest, most effective ways to treat mechanical spine pain. My name is Dr. Dave. I'm the online spine doctor. Happy to answer any of your questions. Comment below. Ask me. Let me know.